point number 1 in the criteria says that you need to have a appropriate access, cavity access or shape that is not preventing you from accessing the canals or the orifices. How do you know that? If you place the probe to reach a certain canal, for example, the mesiobuccal canal, and you had to tilt the probe, the straight probe, too much to the distal from occlusal, approaching it from occlusal view, if you had to tilt the probe too much distally, or if it goes really straight without any angle, it means you are having an either under reduction or over reduction respectively. That's how you know you got a appropriate shape. Number 2, the access cavity is appropriately positioned. That's the satisfactory. And the unsatisfactory is when your access is preventing you from accessing the canal. Again, repeating the same thing. Now, ideally, when you're looking into your access cavity from occlusal view, you shouldn't be able to see all orifices all at once from a single view. So maybe you would see the distal one fully or half of each of those 3 canals. If you want to access the palatal, you had to tilt the mirror more to the buccal to see it, and if you had to see the full mesiobuccal, you had to tilt the mirror buccally and palatally and distally. That's how you know you have a conservative outline. Criterion number 3 says the access outline is over or underextended by less than 1 mm in any direction. Now, how do you know that? Under or over extension. Now, there is no particular measure for the size of the access cavity preparation, but as a rule of thumb, when you're looking at your access cavity from occlusal view, you shouldn't be seeing any wall, any internal wall. These shouldn't be seen from occlusal, and you also must not see all the orifices at the same time. Right. Remaining pulpal horn causing minor obstruction. That's the satisfactory point. Causing minor obstruction in one orifice. Now, how do you know that you have a remaining pulp horn or not? Ideally, you shouldn't be leaving any remaining pulpal horn. However, even if you leave a minor one and it's just in one orifice, that would be all right. In more than one orifice, that's a major obstruction that it will take you into the satisfactory level. Now, using the straight end of my sickle probe, because I don't have the straight probe, the small straight probe that the ADC is providing, or any probe will do, you pass it from the orifice upward. If there is a catch, please note that when you're doing this step, you must not use high force. It must be very gentle so that you can catch any minor access pulp horn, because if you are pulling it forcefully upward, you will not feel the catch. It will disappear. So we are following the tactile sensation, right? There should be no catch. Usually it's above the orifices, most likely the palatal orifice and more distally. All right, Ideally, there shouldn't be any pulp horn remaining. Complete removal, the pulp chamber roof, no roof. Now when we say roof, that includes the roofs above the orifices and the internal wall, the lateral walls. Now, above the orifices, we just talked about it. This is the pulp horn part. In general, the roof, there shouldn't be any roof remaining, that you can visualize it, unlike the pulp horn above the orifices, which you may not be able to see except with a probe. But the remaining roof above the on the lateral walls, internal walls, it can be visible. Please note that mesial wall usually has a smooth continuous wall, no step dividing the part above and below the chamber. And also the buccal wall has internal buccal wall has a smooth flat wall, but the distal wall has some kind of a step in it dividing the area of the chamber from the area above the chamber or above the roof, which is part of the normal anatomy and it's not a roof, so that should remain. How do you know that? There should be no catch when you're passing the probe in between those two compartments. Of course, you can get 3 in this criterion where you have selected the right tooth, so you get full marks, 3. Damage to adjacent or assessment tooth beyond preparation. Most likely this happens if you injure the outer surface, the outline. Any part shouldn't be touched by any minor scratch. That is considered as a damage. The way to prevent that is that you have your burrs always inside the chamber when you're doing the cleaning or shaping. Damage to the gums, that is so unlikely to happen in endo access opening. Straight line access, we just talked about that. So you see with endo criterion, the criteria are interconnected. Straight line access, they're gonna assess your straight line access like this, just like we talked in the first criterion. If you have to tilt the instrument too much laterally, if I'm going to access the distal buccal canal and I had to tilt the probe so much mesial, it means I have no straight line access. Basically, I have a too conservative under outlined cavity that I need to expand. So straight line access means that you can access the canals without too much tilting to the opposite direction. Flare of preparation. So what does that mean? It means that when you're looking from a occlusal view, you can see the internal walls. That means you have over-flared the internal walls, and that is considered an over-reduction. The only instance that should be able to see the walls is that when you tilt the mirror and see the walls. Removal of internal tooth structure, which means the injury to the internal walls, those parts are considered should not be damaged or gouged. No gouges are allowed here because these are considered. However, minor removal is okay, but if you cause gross gouges, it's not it's not forgiven. A minor one, a small one, that is not going to affect your mark. If you injure the floor as well, the floor, by a minor injury, I mean like in without speed, that is okay, it's satisfactory. But if you injure it big time, a gross dentation in the floor, that's not okay. And please note that in the exam the floor is white, not translucent, so they will be able to see those injuries better than we can see them here on those translucent floors. Condition of the pulpal floor: you shouldn't be touching those orifices at all. This part, the red parts, should not be touched. Obviously no debris, so you should make sure that you thoroughly wash the cavity, leaving no debris at all, no dentin. And lastly, cavus surface margin and wall finish. A minor roughness of the cavus surface margin and all the walls, it's fine. The roughness we mean if there is any surface irregularity here, or if you have created a minor bevel. Ideally, you shouldn't be having any bevel at the cavus surface margins, neither any zigzag or any roughness. However, if you accidentally created that, make sure you rub it out manually with any diamond burr to remove it. Thank you.